talk and treat patellar tendonitis. So patellar tendonitis is right here where that tendon is in front of your knee. It is the tendon that comes down. So we have our quadriceps here in our thigh, and they come down, and that tendon goes over top of the kneecap, that patella, and it attaches down here on the shin bone. So it's this tendon right here in the front of our knee. And normally if we kind of push on the front of our knee, we can kind of find that tendon. So what happens is normally it's due to running, volleyball, or basketball, where there's a lot of jumping or that repetitive stress. So this is normally an overuse injury, and it starts out where it's not too bad. It might start out a little bit, a little pain in front of the knee, maybe after your workout, and then it progresses on to it's almost constant. So there's a few things that you can do. Of course, me being a physical therapist, physical therapy is very beneficial. You can go, and we have anti-inflammatory options in the clinic where we could do a phonophoresis, or we could do an iontophoresis to put some medication down into that tendon to help reduce that inflammation. But also you can do icing. What I like to do is get a little cup, like a styrofoam cup, freeze it in the freezer, peel it down, and then you can do an ice massage. Anywhere from 5 to 10 minutes is perfect, and especially if you are playing basketball or if you're a runner or a volleyball player, icing after your activity would really help to reduce that swelling. So you can also buy a little brace, a patellar tendon brace that you just place around the knee. You can get this at your local drugstore, Amazon, and that just takes the pressure off of that knee for when you're being active. So when you're jumping, when you're running, it takes a little pressure off the tendon that's damaged. So some really good stretching activities would be one, a hamstring stretch. So we place that leg out in front of us and we reach for that toe, keeping that back nice and flat. Stretching should be done 3 repetitions on each side, holding for 30 to 60 seconds. So this is our hamstring stretch. Another activity would be a quad stretch. So the front of that thigh that is coming down, our muscles come down, attached to that patellar tendon, to the kneecap, and then down onto the shin. So we would want to stretch that quadricep. So as you can see, I have my knee pulled back further than the one that I'm standing on. And again, 3 repetitions, holding for 30 to 60 seconds each. You should always do your stretching bilaterally, because if you have trouble on one side, you're most likely to have an issue on the other side. Another would be a nice hip flexion stretch. So we just get down on our knee and we step the other foot out in front and we lean into that stretch to stretch your hip flexor, that iliopsoas muscle, and then down into those quads. And again, holding 30 to 60 seconds and doing 3 bilaterally, so both sides. A strengthening exercise, which is a very good option because you want to try to strengthen the quads, you want to strengthen the hip flexors so that they all become stronger and they support that tendon. So straight leg raises are a very good option, where you just keep the knee straight, you raise your foot about 6 to 8 inches up, and sometimes this is easier to be done when you're lying down. or propped up. Strengthening exercises should be done 30 reps in a row. And you could do that 2 to 3 times a day to help strengthen. Also those squats. So we could hold weights, or we could have our barbell across our back, or just start out with a nice squat. Focusing in as you come up, you want to squeeze through those thighs, squeeze the glutes, and straighten the knees. So from the side, we would go down and come up, down and come up. And this helps to strengthen all of those muscles in that knee, making sure that kneecap also comes in. That's why we focus on that extension. Hopefully this helps, and I'll see you again soon.